Hi, let's talk about anxiety in kids, and this is a brief overview for parents. I'm Dr. Lewis. I'm a psychiatrist and child and adolescent psychiatrist, and let's look at the big picture of anxiety. So, normal fears, getting nervous, anxious once in a while, worries about this or that, that's just part of life. But sometimes it's actually a much bigger issue, right? So if a child has anxiety a lot of the time and it's starting to affect some aspect of their life, we begin to think like, is this something more? Is this an anxiety disorder? And there are many different types of anxiety disorders. There's generalized anxiety disorders, so that's just like a lot of worries about all kinds of things and some physical tension. There's social anxiety, right? That's intense worry about social interactions, like what other people think about me, like ruminating, replaying social interactions. There's panic disorder. I have a whole other video about that. There are all kinds of phobias, right? Of some specific thing, a fear of flying, fear of vomiting, fear of heights, right? Fear of various things. There's separation anxiety disorder, right? So intense difficulty, especially in younger kids, in separating from their caregiver. All of these are different forms, flavors of worry and fear, right? So this is worries and fears that could be triggered by something, maybe this is a child with social anxiety, worried about, a school play and being embarrassed, or maybe it's a child with a phobia of some specific thing that's coming up. But those, if it's just like a brief thing with a specific situation that's going on, that may not be a disorder. It may just be like part of childhood. To qualify as a disorder, the symptoms should be there for a chunk of time. For most of these disorders, it's about 6 months. And they should be significant enough that they affect some area or some function of normal life, right? So affect school, affect home life, affect friendships, something is impacted. Things that kids with anxiety may also express or show is this kind of irritability and crankiness. So children may not necessarily, most kids will, but some kids will not say, I'm worried about something. They may say, I'm annoyed, right? Or I'm itchy, right? I've seen this a lot with younger kids. Or they may avoid certain things. They may have stomach symptoms, right? Or headaches, or feel nauseous, or pain that doesn't, that's not identified. They may have trouble sleeping. They may have trouble focusing at school. They may have difficulties with eating enough, right? So sometimes when a child is very anxious, they will not eat, right? And that's a red flag, right? Like what's going on. They may have also like more serious things. They may have thoughts about hurting themselves or suicide, right? So that gets really serious, and we'll come back to that. So different situations can trigger different anxiety disorders. And also many kids may have more than one, right? Or they may have anxiety and also they may have depression, or anxiety and ADHD, right? So if you're concerned and it seems that there's some impact on daily life or some area of life, it's time to try to reach out for help and get some more answers and figure out, like, is this something that needs to be addressed? And you can do a lot as a parent. And there are forms of treatment for child anxiety that really is the clinician and the parent working together. That's the SPACE protocol, which is an amazing treatment for childhood anxiety, where really like the child never ever sees the therapist, right? It's the therapist and the parent work together, and the therapist or psychiatrist, right, coaches the parent in how to help their child with this sweet approach of like, support, you know, I believe in you, I know you can do it, right? And I know it's hard for you, right? It's like, you know, like validation that it is challenging, that they are feeling a lot, and yet you believe that they can face whatever fear they're dealing with, going to school or going to a social event. So depending on what's going on, what kind of anxiety, right? It's, you know, you like potentially like you know, there are books and materials. Like if you just educate yourself about childhood anxiety, you may be able to help your child not develop an anxiety disorder, right? If you see like, oh, there are some signs, right? So there's a sweet book also, Why Smart Kids Worry, right? There are many other resources. The Space Protocol has a book, I don't remember the name of it, that parents can read. It's just available on Amazon, right? So that's like if things are not that bad, and to prevent an anxiety disorder from developing, right? If things are more serious, seek help and get assessed and figure out if treatment is recommended. Does your child need intensive treatment? Do they need therapy? Do they need even medications, or get guidance, right? So, you know, my preferred way of working with kids and anxiety is working with the parent a lot, right? Because it's the system, right? Also, as the parent gets better and less anxious and understands more, the whole family gets better, right? So, and as the parent understands like how and gets support in not protecting their child from feelings, you know, and situations, and conveys this like validation and encouragement, kids get better, right? And the whole system, the whole family gets better. Also, as a parent, you can help your child develop a lifestyle that will protect them from developing anxiety, right? And that's getting enough movement, getting enough exercise. Exercise definitely lowers anxiety. That might be not having caffeine, right? Not having substances, getting enough sleep. It might be learning some coping mechanisms or ways to manage stress, right? Might be like finding like, you know, those times before bed to teach your child like how to calm down with their breath, or some kind of a relaxation exercise. It's also eating well, right? So a healthy diet will reduce inflammation, is protective, right? You will lower the risk for anxiety or any other disorder, right? And also paying attention to like what makes your kid better or worse, right? Potentially working with a clinician to consider like supplements, either minerals or vitamins or nutrients or herbal things that might be helpful too. Or it could be, you know, just food, just eating a healthy diet. And while you can do a lot on your own, if you're worried and you have a feeling something more serious might be going on, reach out for help, right? Then definitely talk to a clinician and get help. And for sure, if there's any possibility or mention of your child hurting or killing themselves, that's like immediately get help. So overall, this was a brief introduction to anxiety in kids. Check out my other videos on related topics. All my love, and see you with the next video.